don't ask me why liver disease is like a massive topic. There are loads of different types of liver disease, different reasons, different functions, different diets. So I'm actually, what I'm going to do is actually try and condense it as much as possible. I've written, because it's such a massive topic, I have written notes. Do excuse me looking up and down, but it's the only way, otherwise I'm going to be all over the place because it's just such an intense and immense subject. So, different forms, different reasons. One of the things that I put in the title is, and I think I can just address this really quickly, why is liver disease such a big thing? Obviously, it's multifactorial, sometimes it's genetic. I think the genetics really comes down to the breeding and the kind of chemicals in line with that breeding and how those dogs have been fed for generations. That really impacts health. It's interesting that portosystemic shunts, couldn't even think of the name then, have increased in Yorkshire Terriers, for example, like 11 times over in the past couple of decades, which is actually something that I saw from Lisa's blog yesterday, so thanks, Lisa. But yeah, we are definitely seeing a higher prevalence, and it is multifactorial, but it's definitely looking at the whole picture, the naturopathic picture, and actually seeing exactly what is going on. Diet has a lot to do with it, commercial diets, lots of fleeing, worming, vaccinations, all of those things, they trigger genetics, and they also overload the body, and the liver is the powerhouse. It's an amazing organ. It's the largest solid organ in the body, and it filtrates pretty much everything, which I'll go through with you. But there are some really awful diseases that dogs are experiencing, and you often find that with liver disease it doesn't just seem to come on its own. Generally there's normally other things attached to that, so you might have Cushing's or diabetes, there might be hypothyroidism. Quite often liver disease ends up in some kind of hepatic encephalopathy. I'm so sorry, I can't get my words out today. Which is like a neurological issue derived from poor liver function. There are, lots and lots and lots of different reasons why these things happen. So sometimes, it can be directly triggered by something, or it can actually be to do with something else that's actually going on in the body. IBD, pancreatitis, gallbladder issues, it's all very much connected, and again I'll talk about that. And I think that's the key bit, actually, is looking at the connectivity and how these things can arise and then how we can resolve them. So we'll look at the main liver disease issues that we tend to see at My Pet Nutritionist. We can look through some symptoms very briefly, and then we can actually look at how the liver actually functions, the factors that obviously orchestrate these issues or actually play a part in it, most definitely. I mean, not necessarily solely responsible for, but sometimes with the liver, unless biopsies are done, and that's very difficult to determine, and actually very suspect kind of operation to do. But sometimes we don't even know what that particular reason, we don't know the reason for it being. But what we do know here is by looking at pathologies, looking at testing, looking at the diagnosis and prognosis, we can always cater and try and deliver a really good recipe and supplement regime that will help support that. So I think one of the most important ones is chronic hepatitis, chronic inflammation that can be caused by so many different things. It might be viral, it could be bacterial even, leptospirosis is one. Drugs is a really, really big one. In different infectious agents, it could be genetics. Also copper. Copper sometimes is retained in the hepatocytes in the liver, and that's either a genetic thing where it's actually not well absorbed, or should I say it's not well assimilated, so it culminates. It might be to do with a zinc deficiency, because zinc and copper very much come hand in hand. If you've got high zinc, you've got low copper, and conversely. And you've got other things like severe trauma. Now, drugs is a big one. I've just mentioned drugs, but phenobarbital and non-steroidal anti-inflammatories, I find, are pretty big ones. Actually, anything to do with the neurological system, you have to be pretty careful. Gabapentin is not very kind to the liver or to the kidneys. In fact, most drugs, often do come with potential side effects. And it's not that we're against the pharmaceuticals, and sometimes, not always, but sometimes they are absolutely necessary. So it's also working around that as to how best to support your dog. So chronic hepatitis, it is the most popular and probably the best managed. You're then looking at portosystemic shunts. I've definitely seen more, sorry, I've got an itchy nose. I've definitely seen more recently, and they are on the rise. Now, portosystemic shunts, it's literally a shunting of blood supply from the intestines through to the liver. What happens is there's a portal vein that runs from the intestines to the liver, and the liver is meant to filtrate that blood to make sure that when it then enters into circulation and goes through up to the heart, it's, all the toxins have been removed. Now, what happens is there's an ineffective circulation, like a connection between the vein and the liver, and it literally shunts the blood supply so it doesn't go through into the liver. It will put it straight into circulation. So then you've got a dog that has circulating blood that actually hasn't been filtrated. And this is a reason, a problem for so many reasons. I mean, the fact that there is not the right blood supply to the liver is obviously an issue that can atrophy, shrink the liver, and obviously function would be impaired. So not only have you probably got these neurotoxins floating around in your dog's system because it hasn't been filtrated well, the actual function of the liver isn't going to work effectively. Now, mostly it's congenital, so it means that they would be born with it, but there are cases, rarer cases, where the systemic shunt actually has occurred because of other issues. It's quite rare. I think normally it's just the fact that it hasn't been detected for a really long time. It might be quite mild. And one of the interventions for portosystemic shunts is to actually have an operation to try and rectify that connection of the vein and the liver. And quite often it can be successful. However, it's still really important to be looking after the liver, to be looking at the diet and making sure it's a really easily assimilated diet. And then again, I can talk about the whys and the wherefores. Then we're looking at acute liver failure, and this tends to happen. Acute means it probably happens within a few days or a few weeks. It can be life-threatening, but normally you see a turnaround. An acute liver failure will normally arise from a viral infection like hepatitis, or possibly from a drug, not drugs, a drug. But it can, it could be something like drinking some antifreeze out of a puddle or something. Now, it doesn't have to be life-threatening. I've seen a complete 180 in acute liver failure. But when we're talking about failure, we're talking about the actual function of the liver going down quite significantly. It's normally deemed at about 70% loss when you're talking acute liver failure. Now, chronic liver failure tends to occur more from the other reasons I was talking about, so the drugs, the copper hepatitis, certain genetics, possibly cancer. Cancer is a really big one, but we wouldn't put cancer under chronic hepatitis, although the dog will probably be experiencing all the same symptoms. And we can't really put that under cancer care either, because you deal with liver cancer quite differently to any other cancer. But it most definitely does happen. Chronic failure would happen from cancer that probably hasn't been detected. Now, with chronic failure, obviously you're not You're not turning around from that. There's normally 75% loss, so it's about maintenance. It's about supporting the dog the best way you can. And we've seen some, really successful stories. And diet has a massive part to play in this, really, really big. You go to any vets, yes, there are some interventions like certain drugs and certain operations, and actually a supplement, Diarrhea, that they quite often use, which is from milk thistle, Silymarin, is quite often recommended, which I'm really pleased when I see that. You're definitely not going to see a 180 with this one, so it is really about maintenance. Now, looking at chronic and acute, I guess hepatitis encephalopathy, oh my goodness, is kind of a syndrome of neurological problems, which tends to be derived from potential blood clotting issues, which is something that the liver deals with, maybe viral. I think hepatic encephalopathy is really important to know that it's normally secondary. Although it's tied in with the liver, the neurological issues that are experienced are secondary to the liver function, the poor liver function, which is basically what I'm trying to say. So signs and symptoms. I think the most important thing is, whatever it is, a lot of although we would obviously go slightly different route with what we would be doing, a lot of the principles are quite similar, which is why I kind of grouped it together. However, if any of you want to know more about a specific liver condition, then it would be really good, post it up, and I will definitely, pay some attention to that, and I'll do something in more detail. Signs and symptoms, obviously some of the signs and symptoms are quite different depending on what's going on, so I've grouped those together. If it's portosystemic shunt, you're definitely seeing stunted growth. Quite often, you'll see it's in smaller dogs anyway, but quite often they'll be teeny tiny little dogs. Ascites, which is swelling of the abdomen, play bang and lip licking. Now obviously some of these your dog might be experiencing, and they might just have some IBD, there might be some food intolerances, there might be a little pancreatic inflammation, doesn't even need to be pancreatitis. So don't freak out by any of these, but obviously collectively when we're looking at a whole host of things, it's definitely worth going to the vets and exploring further. And you would just do a simple blood test to check for liver enzymes. That's one of the big things you'd do. Increased salivation, actually that's more common in cats, but it is seen in dogs. Diarrhea, which is often an orangey colour, which is from bile. Quite often yellowish eyes, tongue and gums, like a jaundice, it's a yellowy tinge. Vomiting, you'll often see that in failure. Vomiting, possible itching. Anything chronic often causes itching. Even with the portosystemic shunt as well, because there are obviously toxins that the liver is unable to filter, they're going around the body, and that creates a lot of inflammation, and it actually sparks mast cell activation, so it can cause a lot of histamine release and itching. It happens with kidney disease as well, really common. Weight loss, lethargy and confusion. Sometimes you can see a really strange kind of walk and gait. There can be weird gazing and glaring. That's maybe more with the encephalopathy. Oh, I don't know why I can't say it today. I say it all the time. That one. I'm not going to say it again. Seizures, really, really common. In dogs that the irony is quite often dogs that might be experiencing seizures tend to go on the drugs that tend to cause liver disease. So If your dog needs to go that route and other natural routes cannot help those seizures, then I always say to people, you definitely want to be looking at supporting the liver with the right diet and supplementation anyway. So that's a bit, what comes first really. And eye health, blindness is quite common. In traditional Chinese medicine, the eye and liver meridian are connected, and it's quite a common thing that people with liver issues will have eye issues too. I saw that with my grandma when she had liver cancer. It just straight down. It's interesting. It's interesting to see. Page 2. So liver function. I guess it's really important to know what the liver kind of does without boring the pants off you. I refer to the liver as the powerhouse because it does everything. It's absolutely amazing. It manages processes and pretty much filters everything in the body. So you're looking at metabolism of carbohydrates, proteins and fats. I mean, that's massive, and that's why diet and restrictive, and I mean restrictive in the lightest sense, because we don't like to restrict here. We're not really low protein, really low this, no that. It's more about, yes, we look at clinical parameters, but we look at really easily assimilated foods and foods that we know will nourish the liver. So we've got that, obviously. The liver filters the blood coming from the intestines. That's absolutely massive. It detoxifies chemicals, it metabolizes hormones, and it deals with drugs and toxins. It's a really, really big one. Glucuronidation is really big, and sulfation is really important, probably more for us humans when we're actually drinking like wine and stuff, but yeah, it's amazing. It does so much. It also helps with the fat metabolism. It actually produces cholesterol and bile as well, so it might be that it's produced bile to help with the digestive system, but equally it might be stored in the gallbladder, and that's where you sometimes get liver and gallbladder issues come together as well. Now what's interesting is the liver, it has 2 lobes, a left and a right lobe, and the gallbladder lies underneath, and then there's a bit of a pancreas, the slight part of the pancreas that's kind of underneath that as well, and also part of the intestines. Now these organs, the liver and those organs, they really do work together, and I'm actually going to talk to you about digestion and how that can impact everything in a minute, but it's really important to know that it is a system. So one thing goes wrong, it's always going to have a knock-on effect on something else, and it quite often you'll find that it's not just liver, it will encompass something else, which is interesting because it means we might deal with it in a slightly different way. So the liver, it also makes blood clotting factors. It also helps with some vitamin D synthesis as well. And what's amazing, and this is amazing, and I'm sure a lot of you already know, but it's an organ that actually regenerates itself. So if you actually had a liver biopsy and had some cut off or a part that atrophied, if you actually then start feeding the right diet and supplementation and so on, it can actually then start regenerating itself. Obviously, if you continue giving chemicals and commercial foods and what have you, you might not have the same effect, probably not. But that in itself is just amazing. Okay, so factors that might contribute to liver disease. This is obviously incredibly important, and poor diet is a really, really big one. Now, dry food, and I always go on about this because dry food is wrong for so many reasons, but one of the things is obviously there's a lot of starch added, so it sticks it together, and therefore it has a high carbohydrate content, normally anywhere between 30 up to about 68-70%. Now, one of the things that we often find with that is that dogs quite often are overfed because they're trying to satiate this hunger because of the high carbohydrates. But the high carbohydrates need to be processed by the liver to actually then transform them into fatty acids and triglycerides, and then they'll actually be transported and turned into adipose tissue, so fat, which I think maybe I've had one too many carbohydrates. So a dry food diet is not fantastic. It's not going to really support a system that is going to be overtaxed, whether it be to do with genetics, whether there are other factors involved. It's never going to nourish the body, and that's the most important thing. Every single cell is a vibration of what we're eating. That's the same for our dogs as well. So it's really important that they have the right components to heal. And I think it's never truer in liver disease. It's true in every disease and just health. But it's really, really very, very big deal in liver disease. Now, poor digestion, and I need to explain here how the stomach, the intestines, the pancreas, the liver and the gallbladder are all connected, and I think I've spoken about this before, so I want to go on and repeat myself, but it's really, really important. So quite often what you find is if a dog is experiencing some sort of inflammation in the gut, quite often what happens is the digestive system, the stomach, actually becomes inflamed. You might get some form of leaky gut. And the extrinsic part of that one cell epithelial, that lining that produces HCl, hydrochloric acid, which helps digest proteins, fats, discriminate between good bacteria, bad bacteria, balance good microbiota, get rid of parasites and pathogens, all that stuff. That isn't produced as effectively, and this is sometimes where things can begin. And I always say everything oscillates around the digestive system. So if that isn't working properly, then eventually, for many different reasons, you're going to get other problems come in. So for this very reason, if the first part of digestion within the stomach for fats and proteins isn't digested effectively, it then has to ask the pancreas to do more work in the duodenum. And so the pancreas has to release more enzymes. And from this, the intestines then goes, hold on a minute, there's a finite amount here of enzymes, this has not done the job, so I'm going to have to ask the liver to produce more bile. So it might ask the gallbladder for the reserves, or it might actually be poking and flagging at the liver. And so sometimes you'll even find that liver enzymes are raised, so there might be a little inflammation, even if your dog just has a bout of IBS, for example, or has had a flare of pancreatitis or what have you. So it's this cycle that tends to ensue, and this is very much connected. So that microbiota, the good bacteria, and how the gut functions is one of the most important things. Now, what's interesting is that we know from microbiota, from that good bacteria is produced what we call postbiotics, and they're also known as metabolites. And these metabolites are immune enhancers, and they communicate with different parts of the body. So we know from research that actually certain bacteria, particularly for humans, we know this, but dogs and humans were so similar in pathology and in the pathogenesis of disease, that we actually know that certain strains of bacteria are actually really helpful in supporting liver function. So digestive health, really, really important. Stress is a really big one, obviously. Stress can impact pretty much anything. It can switch genes on and off. It can create systemic inflammation. And, maybe your dog might have a predisposition to some form of liver disease, and that can really spark things off. So we always look at stress. In fact, stress is just a really big driver in a lot of disease. It's not solely responsible, and it's always multifactorial, but it is really important to know. Copper toxicity, which I spoke about, it can be genetic, so the hepatocytes actually store copper, and that damages the hepatocytes. But sometimes it can be to do with low zinc status. So quite often you'll find some of the foods that you end up getting from the vet, for example, might be really high zinc, really low copper, really low fat, really low protein, really low life. I mean, horrible stuff. Sorry if there are any vets watching. So copper toxicities, obviously, and copper is a really important thing, you know, it's really good for the brain, it's good for immunity, it's part of the methylation process, so DNA synthesis, so every single cell in the body's requiring it. It helps with energy production. I mean, it's amazing stuff. But obviously your dog doesn't want too much of it, neither do we, because it causes damage in the liver. So copper toxicity, and there is actually a drug that some vets use that actually help take out that copper toxicity. Obviously it's important to know what exactly is going on for the dog and to work then alongside the client as to what you would do. But quite often we end up creating a recipe that's very low copper. Interestingly, when you look at natural whole foods in life, so what would that be? Oysters, organ meat, shiitake, kale and chard, Swiss chard. I mean, they're to name a few. Wheatgrass is a really good one. They're all pretty decent amount of zinc in there, give or take. But you always find that in composition to that will come a certain ratio of copper, and I think that's really interesting, you know. We're not using synthetics, we're using whole foods, and they're the things that will naturally nourish, so we're not going really high zinc, really low copper. I mean, obviously, unless that's actually required, but I find that element really interesting. Going off piece slightly. Endocrine disease quite often can be associated, or the cause of liver issues. I often see Cushing's disease and liver disease together. Or you might just find that actually Cushing's raises some of those liver enzymes and definitely puts more pressure and more inflammation on the liver. It doesn't necessarily, and obviously everything is measured by clinical parameters, so you obviously need to go to your vet and actually get a formal diagnosis, and then we obviously look at all the history, the diagnosis, and then the pathology, of the test results that you've actually got. But Cushing's is a really big one. Diabetes, hyperthyroidism, so an overworking hyperthyroid. That would be seen more in cats generally, but it does happen. I think in that instance, you're obviously looking at it from a slightly different angle. So you want to also be supporting that element of disease as well. And this is what happens naturopathically. You know, you're looking at the stress, you're looking at different organ systems, you're seeing whether there are other pathologies going on. So that's a really interesting one. And definitely there are things that you can do to help that will indirectly impact in a positive way the liver. Infectious agents like leptospirosis or viral, obviously hepatitis, that's a really big one. It's quite often unknown. I mean, sometimes, you might have really, really high levels of white blood cells on the test. That might indicate some infection. Sometimes it's not known, and that's the thing. Quite often, the etiology is actually not known. So it's just working with what you know the best way you can, and it can be very successful. Severe trauma. I have never seen it myself, but I do actually have a colleague whose friend's dog was accidentally hit with this metal baton, and that caused chronic liver failure. Yeah, that was really sad. You'd be really gutted if that had happened. Pharmaceuticals, as I mentioned, it's a really, really big one. Non-steroidals, phenobarbital, and your barbitals, your gabapentins, all neurological. They affect blood flow. They're a real concern. Obviously, the liver has to metabolise those. So, if your dog's overloaded with drugs and overloaded with different toxins like flea treatments, worming treatments, which come under pharmaceuticals, that's a lot of pressure on the liver, a lot of toxicity, and the liver is going to obviously have to respond to that, and that causes more inflammation. So that's a really big one. So those are the first things to go or to manage and to support the best way you can when you know that, you know, these things are happening. Vaccinosis. I have known one dog actually go for a leptospirosis vaccine and 2 weeks later was in acute liver failure, and we did manage to turn that around. And actually we dealt with it like it was a viral load. I think it was probably, I mean, leptospirosis I find really pointless anyway. And it's bacterial, but it is definitely something that does tend to affect the liver. So vaccinations, you know, I don't need to go on about vaccinations, but do titer testing. I find leptospirosis honestly quite inappropriate. They come with the most adverse reactions. I know a lot of dogs, a lot of poorly dogs and dogs that have died from leptospirosis. So it's just worth, I never feel like I'm the one that should say you should or you shouldn't, but I think it's about doing your research and weighing up the options. And leptospirosis is a bacterium anyway, and can be dealt with really successfully, like 90% success rate with antibiotics, so that's crazy. Right, so obviously there are conventional interventions that can be used and might be used. The main thing that you're going to be offered is a prescription diet, which is normally low copper, high zinc, low protein, low fats, anything that's not going to overtax the liver. However, if it is commercial, if it is over-processed, it generally doesn't feed the body very well, and it does actually seem to overtax the liver still. And quite often I find it's just not nourishing the dogs, and the dogs ends up with different atrophy, like atrophied muscles, and you end up with a whole host of other issues alongside that because you're trying to maintain life through this commercial diet. So, I mean, one of the things we obviously always promote is a fresher, more bioavailable diet, and I actually prefer cooked. Raw, and it's still debatable as to why, but it obviously cooking something, when I'm looking at the calculator and I'm actually going to develop a recipe, it will have different calorie output, it's assimilated slightly differently, and I think it actually takes a little pressure off the system. I do tend to find it's just more successful. I have had more success with cooked than raw. So you're looking at certain qualities. You certainly don't want to be doing the dry foods that are often higher in sodium anyway. But yes, we might be looking at low in phosphorus because particularly if it's a portosystemic shunt, you want to be taking some real pressure off, so you want lesser phosphorus. We don't go really low protein here because you end up with a whole host of other issues, and quite often, as long as it's a really good bioavailable protein, like tripe is amazing, low fat, low phosphorus, that could be really amazing. I quite often put some tripe in if it's tolerated into this kind of a diet. Moderate protein, it's normally slightly higher end for us, but it's kind of on the cusp. Omega fats and antioxidants is something I always want to do. Vitamin deficiency testing is something I always do. A, D, E and K, because they're fat soluble, they can often be an issue. Zinc is obviously a really big one, so I would always check for that too. And Bs, B9, B12, B1, they're all, a lot of the Bs, choline, a lot of those tend to be low in liver issues. But really it's just about, I mean, don't go too headstrong on the calories, what you're allowed to eat, what you're not, but it's just about making it really absorbable, assimilated foods that are very easy to break down. So, you know, sometimes you're just looking at lean meats. If it's a chronic hepatitis, I probably don't need to go low phosphorus really. Venison, turkey, fish, kangaroo, they tend to be really good options. If you want lower phosphates, you can go with the tripe. I love the green veggies like broccoli, kale, particularly broccoli. It's got DIM in there from indole 3-carbinol, which is really supportive to the liver. The same with Brussels sprouts. Actually, broccoli also contains glucobrassicin, which is almost like a precursor to that regenerative aspect of liver cells. Antioxidants are a really big thing. There's actually some research on berries and whole cranberries that was done in rats. It's the anthocyanins, proanthocyanins actually, that have this hepatocyte protective, or should I say hepatoprotective ability. They're really quite amazing. So it's quite nice. I mean, look, I'm not all about lots of fruit, but they are a really nice aspect to add into a liver diet. And also, I'm really careful on sodium levels. I'm often adding a little bit of Himalayan salt. Salt often gets missed when people are doing their own food, like, you know, raw food or what have you. But it's obviously really important to get the right kind of split. And the only reason being, with bile salts, sodium and potassium are required. So we need enough for bile production, but we also don't want to overtax the liver either. So sodium is also one. We always think that's kidneys, but actually it's worth looking at for liver function as well. Obviously, diets, low copper, clearly, if there's copper toxicity. But I think a really big thing is it's very dependent on what's going on for that specific dog. So although we've got a generic idea of what we would do, it's also then very specific to the dog. So it's not like I'm going, so you have to come and see us. I'm just saying it needs to be considered as a whole, just to really have full impact. So supplements, everybody knows I love supplements. Supplements to consider, ashwagandha is a really good one if there is stress. Now, ashwagandha is an Ayurvedic herb, it's an adaptogen, and it actually helps regulate cortisol levels. It's also a precursor to serotonin and melatonin, and it helps with estrogen dominance and all of those other things. But ashwagandha's a really nice one if cortisol might be a little too high or a little too low. I use it quite successfully in Cushing's, and also just general stress related issues, and rhodiola as well. Ashwagandha is a prebiotic, and sometimes it can cause a bit of gastric disruption. I do tend to get a lot of sensitive dogs come my way. So in that instance, then I would generally use rhodiola. So, but the two, they work very similarly. Can't even say that word today. B vitamins, I quite like a B complex. I tend to use Methyl B complex by BioCare. It's a liquid. It's amazing. That's brilliant for liver function. Super, super amazing. Taurine can be really helpful in terms of bile synthesis. If your dog has a fatty liver, taurine can be really amazing. Probiotics, obviously, as we spoke about bacteria, that's so incredibly important. You really want to make sure that the gut microbiome is right, that the HCl levels are really strong in the stomach, and that we're feeding a really nice natural diet. You generally find with the probiotics, the bacteroids, they do create certain postbiotics, and they are supportive of the liver. So, you know, it's important on lots of different levels. Obviously, you know, microbiota, you've got like 75% of immunity in the gut, so that's incredibly important. Curcumin, I really like curcumin BCM 95. It's a registered curcumin. It's an active ingredient in turmeric, but this particular one comes with all the other whole side of like the whole turmeric, which is incredibly important as well because it obviously contains other phytonutrients in there. It's amazing for oxidative stress. There is a lot of research around liver regeneration because there's a lot of oxidative stress that goes on within the liver when there's damage. And of course, if there are other aspects of inflammation going on in the body that then might impact the liver, that's also really amazing. Obviously, I would only be using it if I really felt that was the right route to go, but it is a really good possibility. Omega-3 fatty acids are so important. I particularly like krill in this instance, just because they come with phospholipids. They've got phosphatidylcholine in them naturally, so that's really that's hepatoprotective. It's also really great for the brain. It's going to help with any kind of inflammation of the liver in particular, and there's actually a huge amount of research around regulation of the hepatic tissue and the adipose function. So, you know, that's why we always go low fat with liver, taking some pressure off the liver, but it's good to put in those essential fats to help support things. Looking at fat soluble vitamins, obviously with fat soluble I always test first. Vitamin D, I cannot tell you, vitamin D has got to be low in like 90% of my clients, and that goes with liver disease as well. Obviously we always make sure that we're hitting certain markers on recipes so that there is a level there of A, D, and K. However, it's really important if there's a deficiency that needs to be addressed. Food alone probably isn't going to do that. Yeah, I think that's quite a misnomer, thinking that foods are going to address a deficiency. Unfortunately, a lot of foods don't quite contain what they used to because of agriculture, the quality of our soils and so on. Totally going off piece, but there's an amazing place in Mallorca that create this biochar that they've started putting in the soil, and it's regenerating the soil, and they're like doing this comparison between soil with biochar and then just your regular soil, and the stuff that's coming out of this biochar stuff is just amazing. It's like charcoal based. But yeah, agriculture, basically, you know, what goes on at the moment, we don't get the same level from foods. So it is always worth looking at deficiencies. Zinc, obviously, if there's high copper toxicity, adding in a good amount of zinc should help chelate some of that copper out. There are some drugs that some vets might want to use. Obviously, that's really important, but I think zinc, it's the second most important mineral, and honestly, I'd only say about 15 to 40% of zinc's generally ingested. It's picked to the post by everything else, which is why I often recommend maybe giving zinc separately in a little treat, not on an empty stomach, because sometimes it can cause a bit of gastric upset. But you know, you want to give it its best shot at being absorbed. Its malabsorption with zinc is actually really quite common, and obviously zinc is incredibly important for so many different things. So sometimes copper toxicity can be because of that. It doesn't have to be a genetic accumulatory kind of issue. And then we're looking, and obviously milk thistle, really, really big one. Silymarin, denamarin that the vets use, amazing, although they've got some flavouring, some E number or something in there, which I'd rather wasn't in there, it's annoying. But milk thistle, it works on, I guess, four major elements. So it works on oxidation, so free radical scavenging. It stabilises cell membranes and permeability. It limits hepotoxin on hepatocytes. That's actually been studied greatly. It helps also to aid and regenerate the liver. And with milk thistle, you're then also boosting methionine, glutathione, particularly glutathione production. And glutathione is a really important antioxidant that protects the liver. It's also really important for glucuronidation. And then you have other sort of offshoots of different amino acids like SAMI, which is adenyl sulfonyl L-methionine. I can never say that, so we'll call it SAMI. And N-acetylcysteine as well, which is also known as NAC. And these tend to be precursors to glutathione and oxides regenerating liver function, and that's really incredibly important. Now, I'm kind of going to end it. I'm going to break things down now. I don't want to go on and on and on. What time is it? Yeah, 45 minutes, blimey, I'm going to stop now. But one of the things that I think is really interesting, which I'm going to end on, is liver regenerates between 1 and 4 a.m. in the morning. So it's really important. You'll often see dogs that have fat metabolism type issues, so anything to do with IBD, pancreatitis, gallbladder, liver, are always going to be a bit more lip smacky at night time. They might be awake, they might not be able to sleep, they might stare gaze, they might do some weird kind of stuff at night time. So one of the things that I often suggest, and you do need to be careful with the milk thistles and the things that help regeneration, and I always say we go really, really carefully. But one of the things that I find really helpful is actually putting those in at nighttime feed, so they're actually more bioavailable to then help support the liver regeneration between 1 and 4 in the morning. Obviously, I only go really, really slowly, and we kind of work our way up to things. I'm not about more is better, definitely not. But I think that's a really interesting thing to finish on. The liver is most active in the morning, and if you've had a lot of alcohol, it's best to get to bed before 1 o'clock so your liver can regenerate properly. I mean, really probably before 12, but yeah, that definitely does help, because if you're going to bed after that, it actually doesn't get to regenerate the way it should, and that's why you feel so awful. You know, when you don't sleep well and you wake up and you go, God, I feel like I've got a hangover. That's why. So I'm ending it there. Thank you, lovely people. It's really nice to be back.